On Friday, April 26th, the Vermont Futures Project touched down in Manchester at the Community Library to present some findings and discuss trends in healthcare and wellness in Vermont. The Vermont Futures Project was launched in 2016 by the Vermont Chamber Foundation, an affiliate of the Vermont State Chamber of Commerce, and tracks and promotes the state's economic activity. A panel of 3 executives in the hospital and healthcare field followed William Schuldeis, the chairman of the Futures Project and the CEO of the Vermont Teddy Bear Company. They described the direction they saw Vermont's healthcare industry heading. Tom Dee, the CEO and president of the Southwestern Vermont Medical Center in Bennington, was one of the presenters. He spoke to the transition underway within healthcare centers and hospitals to focus on and encourage wellness and keeping people out of the hospital rather than treating people only when they get sick and charging them for medical services at that time, the so-called fee-for-service model.
In the past, we were just caring for people. We provided services that hopefully make people better. Now it's different though. Now the definition of what we call the definition of the H, the hospital, is moving towards a much broader realization that we're here to help to keep people healthy, not just care for their illnesses.
An alternative model, known as the all-payer model, is one where hospitals would charge the same price for each service to every payer, forcing the hospitals to compete with each other on price, much like other businesses do.
So we've been waiting for people to get sick and treating them sort of on a piecemeal basis, charging for every procedure and office visit and surgery and appointment that people have. And so we know that as fact number one, that the healthcare system has sort of been designed around that premise. The second thing we know is that if you look at the pie chart here, 80%, roughly 80% of our health is determined not by the doctor we go to or the amount of health care we get, or even the quality of health care we get, but it's determined by behavior, environment, and genetics. So what we do in our lives, the choices we make around exercise and smoking and where we live, the environment, which is a lot of the social determinants of health, including Bill mentioned that every community needs safe sidewalks and that those that have those safe sidewalks prosper in a different kind of way for something as simple as safe sidewalks.
Tom Dee also focused on Bennington County's health profile, which overall is among the laggards in the state. By most major indicators, Bennington County is on the bottom end, not just in wellness indicators, but in other factors like employment, income, and housing that have a direct bearing on an individual's health, he maintained.
A little bit before I got there, we lost almost 2,000 jobs. And this doesn't even count the latest casualty. I saw kids almost casualty of war where we're going to lose another 140 jobs with the closures of the Vermont College. So this is a very significant challenge in terms of the job loss in our area.
Claudio Fort, the CEO of the Rutland Regional Medical Center, and Jeff Tiemann, the CEO of the Vermont Association of Hospitals and Health Systems, were the other presenters, who, like Dee, described a push to promote healthy lifestyles and also warned of the growing difficulty in finding qualified nurses and luring doctors and physicians to rural areas. Afterwards, we had a chance to talk briefly with Tom Dee and his observations on the Vermont healthcare scene.
Service to a value-based model of reimbursement is challenging because right now hospitals, health systems are living in both systems. Part of our reimbursement is fee-for-service, part of it is value-based. I think once the systems move much more to a single arrangement, a single model, it's going to help facilitate change much quicker. Because right now it's a little schizophrenic. We're not quite sure, what we should be doing all the time in terms of handling the different type of services and the different systems. It confuses providers, it confuses patients. So I think it's just part of making the transformation to a single system, making that decision, going forward, and putting all your resources in that one direction. And so that's going to take some time. It's going to take another, probably over the next 10 years, but it's going to happen at an accelerated rate.
The Vermont Futures Project will be holding its annual conference in Burlington on May 30th, where the focus will be on the changing nature of the state's workforce. For the GNAT-TV News Project, I'm Andrew McKeever.